Hello, so today I will be talking to you about surgery during the War of 1812. Surgeons back then would have to follow along the regiments and treat as many illnesses, disease, wounds, anything that they could. So they weren't just surgeons, they were also doctors who were diagnosing patients. They were apothecaries prescribing patients medicines. And of course, they also had all their regular surgical duties. So being stationed up here in Sault Ste. Marie or even at Fort St. Joseph during the War of 1812, treatment back then was often very limited. So these tools would be part of the surgeon's kit 200 years ago. One of the most common operations that the surgeons would have to perform are amputations. So if you see here, this is a 1 ounce lead shot. So the muskets that the soldiers were using would fire off these. Now with this shot, it's basically like a cannonball. When you were hit, say in the arm or the leg, this ball would basically act as that cannonball coming through, ripping through flesh and bone, not leaving anything for the surgeon to repair. So the only thing that they could do back then is amputate. So what they would want to do to start with is they would want to treat the patients as soon as possible. So sometimes the surgeons were right up there on the front lines treating the patients as they came off the battlefield. So the surgeons would lay the patient on the table, have a whole bunch of the other soldiers hold him down. They might put a stick in his mouth just so that they didn't have to listen to him screaming. They would then use a tourniquet and tie it tight around the wound and wind it up as tight as possible, just so that they cut off as much of the blood supply as possible. You could have a simple tourniquet like this. Sometimes you had a screw tourniquet that had a big, huge screw on top so that you could tighten and crank it a lot tighter than you would have with just your simple leather and cloth tourniquet here. After the tourniquet was applied and the blood supply was cut off, they would then take their capital knife here. The capital knife would cut through the flesh and the muscle all the way down to the bone. Once the bone was exposed, they would take their capital saw and saw through the bone as fast as possible and cut through the bone. After that, we would get our tenaculum here. We would then reach for all the veins and arteries, and we would tie them closed with just a little bit of thread here. And that was because we didn't want to completely close the wound by, say, using cautery as they always did before, because once you completely close that wound, say with a cautery iron, you are sealing in the infection. So we knew that we wanted the wound to breathe. Now, if you got hit with this musket ball, say in the torso, chances are the musket ball would stay lodged in your torso because these balls are traveling at a very low velocity. So they're traveling very slow. They will, once they hit the bone in your torso, whether it's ribs or whatever it is, it's gonna probably stay lodged in there. So now, first thing that we could do is we could reach in there with our hands and try to grab that ball out if we couldn't get it out with just our dirty fingers. After that, what we would do is we would use a probe here. So we would go in and we'd try to find where that ball is. Once we hear where that ball is, the metal tapping on metal, we would take our forceps here, reach in, and pull out the ball. So now this ball is removed, and then we will stitch you up, wrap it up, and then send you on your way. So these are some of the most common operations that we would perform all of these big surgeries after battle. Now, some other surgeries that we would perform may be a little bit more on a day-to-day basis, or just as the regiment was traveling through. So sometimes if a soldier wasn't feeling well, what we would do is we would prescribe a bloodletting. So we would take our lancet here, make a small incision in the arm, and then we would collect the blood, taking maybe about a pint of blood at the same time. Now, back then, we thought that if we were taking your blood from you, we thought that it would help to calm you down. So if you've ever had any blood taken, or if you've ever given any blood, you might have a little bit of that faint feeling after having your blood taken. Now, for us, we believed, oh, okay, if we have your blood taken, that's gonna drop your energy down, so it's going to calm you down. Well, it's probably also gonna calm down any illnesses that you have too. So say if you had a fever where it's spiking, we would want to drop that fever, so we are going to prescribe bloodletting. Now, say if we wanted the opposite effect, say if you had somebody who suffered from depression, they were very lethargic, lazy, we would want to sort of perk them up. Or if you had any illnesses that were sort of calming or anything like that, we would want to bring that back up. So we would use blistering or cupping. So blistering, what we would do is we would take our cautery iron here, we would heat it up over the fire, and then we would apply blisters to your chest and your back. Now, if you've ever been burned, you know that it really hurts, and maybe you might feel a burst of energy after, as pain endorphins are being released. So that's boosting you up, that's making you feel better. Now, the other one I said was cupping. So cupping, we would take a little bell cup, and we would heat it up inside, apply it to the skin, and that would draw up the blood to that area to help improve circulation. Now, we could also do a wet cupping method where we heated up the cup, applied it to the skin for about a minute or so, remove it, make a small incision with our lancet here, and then we would reheat the cup and reapply it, and that would draw out the blood. So we believed that either the two methods would be very beneficial for you. And well, as you might know, cupping is still being used today. It's an ancient Chinese practice. You can see many people still using the cupping method, most oftentimes just the dry cupping method. And you can see that it still helps improve the circulation. Now, we also have our fleam. So these are 3 blades here. We would take this and say if we wanted to take blood from a specific area, say if you were suffering from migraines or any other sorts of maybe neck or back pains, we would take blood from along your spine. So what we would do is we would take our fleam here, we would take a nice heavy stick, and we would hit it, and then it would make 3 small incisions on your skin, so that way we would only draw small amounts of blood in the areas at that time. The other bloodletting that was more common was usually just done on the arms, taking that 1 pint at a time, and that was sort of more the general overall cure, whereas the phlegm is more of the specific cure. Now, if you were suffering from persistent migraines, we might prescribe something a little different. Now, that procedure is called trepanation. And so this is our trephine or trepanner here. And what it would do is it would drill a hole into your skull. And so this practice has been around for thousands and thousands of years. And we found skulls that are about 3,000 years old with the trepanation holes in them. And also with those skulls, we can see that there's bone remodeling around the trepanation hole, so that we know that the patient had to be alive sometimes afterwards for that healing and remodeling to occur. So 3,000 years ago, and even about 2,000 years ago during the time of Hippocrates, whom we know as the father of medicine, prescribed trepanation procedures where he would take a knife or even a chisel and chisel out a square piece of your skull. In about the 1750s, we came up with the drill method. So this is where we would actually drill a hole in your skull and take out that piece. So first things first, we would probably put another stick in your mouth so that we didn't have to listen to you screaming. We would have a bunch of people holding your head as tight as possible, because one thing that you have to remember is that during this time, patients didn't have anything to put them to sleep during the surgeries, no anesthesia, and they didn't have any anesthetics, and that would be anything to dull the pain. So you were wide awake and feeling everything during these surgeries. So that's why I was saying a good surgeon is a quick surgeon, because you wanted to get through the operations as quick as possible so that the patient wasn't suffering through them. So once the patient's head was held as tightly as possible, we would go in and we would take our scalpel, we would make an incision in the top of the scalp, and then I would get my assistant or my apprentice to hold open the flesh with the retractors here. Once that was held open, we would then drill a hole into the skull, removing a coin-sized part of your skull. And now that would relieve a lot of the pressure. So if you had a head wound and we needed to relieve that pressure, there was a skull indentation after you had been hit in the head, and we wanted to pop that piece of the skull back out so that it didn't poke into your brain and cause brain damage, we would use this procedure. If you had suffered from constant migraines, we thought that was due to the pressure in the head. So we would want to relieve that pressure. Also, for a time, people believed mental illnesses were caused by bad spirits in the head. So they would want to drill out a piece of the skull to release those bad spirits. So oftentimes you can find people who were in places like Bedlam were often being prescribed trepanation, and many skulls in the Thames have these trepanation holes in them, meaning that back then it was fairly common practice. Now, for the most part, after we took that piece out of your skull, we would sew you back up and send you on your way. So you would be walking through life with a hole in your skull. If you were a little bit wealthier, you could take a silver coin here and we would be able to fit that into your skull, because as you can see, it is a perfect fit for the trephine. So we could close up the wound with a silver shilling, and the bone would start to grow around the coin, And at that time, we knew that silver didn't really have as much of the pus afterwards as others, meaning it didn't cause infections like other metals could. So silver is very antibacterial, as we know now. So that is pretty much all of the surgeries that we would go through. Another one might be tooth extraction, just a simple taking of the forceps and ripping out a tooth. As I said, we would be the apothecary as well, so we would have a lot of medicine bottles where we could prescribe you anything. So if you have any questions or comments about the surgical practices during the War of 1812, leave a comment down below and we will try and get back to you. Thank you for listening and have a good day.